Kedren provides
recovery,
a future,
support,
love,
empowerment,
meaning.
I'm really very excited about what we're doing. It's a natural flow for me to come to work because I enjoy change. I like systemic things. I enjoy seeing things happen. And I feel that I still have a lot more to give.
Kedren is so innovative under Dr. Griffith's leadership because of our one-stop shop model. We provide mental and primary health care, employment services, early education, and housing. These are all fundamental elements to a healthy community. And so what we're looking to do is expand these services to our 111th location, thereby changing the trajectory of children and families' lives towards a better future.
Kedren is extremely important, not only because obviously physical health and mental health should be a priority, but a lot of the times children in these neighborhoods don't have access to this. I remember being a child and having to go to Tijuana for medical care. That was the norm.
Unfortunately, we are living in a society where our income earning potential and our basic wages aren't in alignment with the cost of living, especially in Los Angeles. Middle income families are struggling with the cost of living. So when you compound that general sense of need to find a job and to maintain a household and take it down a notch to individuals within our community, you can begin seeing some real problems in the system.
Low-income urban areas have higher rates of violence. Children in these situations, unfortunately, are adversely affected psychologically and emotionally. When children are developing, these are the primary things that kids need to develop into healthy adults.
There are obvious things that you face, the gang violence, the drugs, but there's this vibration, there's this energy that can grab a hold of someone so young and so tender, and that vibration can breathe and live within you. Most of the time you fall victim to that. It's very seldom that we rise from that.
We see a lot of children who come in with, who have been victims of abuse, neglect, abandonment, children who have experienced, who've been exposed to domestic violence, crime, a lot of gang activity, bullying in the schools. So these children come in with anxiety, depression. They come in with symptoms of post-traumatic stress disorder.
We have families where one or two parents are working 2 or 3 jobs just to make ends meet. And we're creating a generation in a densely populated urban area of children who are latchkey kids. And that filters into children going out into the streets and being exposed to gangs and being exposed to trauma.
Unfortunately, I fell victim to the violence, and I became someone who was very aggressive. In order to protect myself, I became a bully. I got pregnant at the age of 14. So I decided to remove myself from the family and give birth to my daughter, who's now 20 years old, and she's amazing.
Because when I see those children here driving around South Central, I see myself. And I know what they're thinking, I know what they're feeling, and I know what their problems are and their priorities. It's trying to they're making it day by day. They're not looking past the week. They're not looking past the year. They're not dreaming or wishing. They're just trying to survive that day. And I feel that these children feel caged because they don't feel that anyone's listening, or if anyone's listening, they feel stupid. They don't want to talk. They don't want to go and look for a job or look for things to do. They don't want to join a team because they're just embarrassed. They're caged.
You know, there are many challenges in this community, but there's also many strengths. And we build on those strengths, and we help people to function as the best they can.
I was a freshman in high school. There was a nurse that didn't know much about me at all. She came up to me. She knew I had a daughter. That's what she knew. And she came up to me and held me by my shoulders and said, "All that I ask is you graduate from high school. If you graduate from high school, I'm going to give you something special." So to her, she sort of dangled a carrot at the end. But for me, it was that moment. It was that. She cared. She believed. She didn't even know me.
Irrespective of what you learn at university, one of the key things that works is making that person feel involved and having the compassion to deal with the kinds of problems they present, because there are many.
Particularly the children, very resilient. They go through a lot of these crises and they still come up. And we need to support that.
It's an honor to be a witness to people's lives and this journey that they're on. And sometimes the stories are rough, but you know, there's also really great stories, and you leave work knowing that you touched somebody's life in some way.
Move beyond can we do this to how do we do this is a very rewarding part.
I'm fortunate to work with such a talented team, people who are so passionate about changing the lives of children and families in South Los Angeles. And like the 12 founders of Kedren, are willing to commit their time, their network to acquiring the means to expand the one-stop shop model to 111.
So we want to be able to help and give back in any way that we can. And now that we have the ability to do so, we want to do it. What gets to me when I see the families at Kedren is we relate, because I don't want to see my kids go through those types of situations. So when I see kids like that, it touches my heart. And I know that if I don't want my kids to be going through that, I don't want anybody else to go through that.
We all deserve to be believed in. We all deserve to be loved. We all deserve structure.
These children in this city, they're the forgotten children of Los Angeles. And they're our future. And if you don't see it that way, then you have to go back and reevaluate your life. If we don't care about them, you have to care about them.
Join us.
Pay it forward.
Take action.
It's us.
We.
Our.